Hi, my name is Noam Arzt. I'm the president of HLN Consulting, and we're very pleased to be here at the ASTO Tech Expo and to be sponsors of this event. I'll be talking for just a few minutes about TEFCA, something brand new that's coming down from ONC, and I think it could be extremely important to public health. First, just a very quick slide on HLN. We've been around for now nearly 25 years, and I think we're a pretty unique group. We have both a very deep technical experience as well as doing work on strategy projects, and I think that gives us a very unique perspective into helping public health agencies solve their ongoing information technology issues. But let's talk about TEFCA. What is this? TEFCA actually is two separate but interrelated things. First, the TEF part is the Trusted Exchange Framework. So this is a new technical framework to support nationwide interoperability of health information. To support that, TEFCA brings along the CA part, a common agreement, a shared set of rules that all participants agree to abide by. TEFCA comes out of two pieces of federal legislation. First, the HITECH Act that goes all the way back to the Obama administration and is just about sunsetted now, which was, among other things, the legislation that brought us in meaningful use and the big investment in electronic health records that's been happening over the past 5 or 10 years here in the US. And then a second piece of legislation, more recent from 2016, the 21st Century Cures Act, which is a set of requirements from Congress, primarily on ONC, to look at a particular set of issues within health information and particularly related to health information exchange. The TEFCA initiative was developed by ONC and launched by ONC. They then, in September of 2019, through a competitive bidding process, contracted with the Sequoia Project, a nonprofit, to become the RCE, or Recognized Coordinating Entity. Leave it to government to think up in incomprehensible acronyms. Essentially, the Sequoia Project is now contracted by ONC to manage and operate the TEFCA network, which once it's established. In January of 2018 and then in April of 2019, ONC put out draft plans of the TEFCA project. And you can see through links there that I actually commented along with many other people on the two versions of those draft plans. But why is this really important now? Because in fact, in January 2022, just a few months ago, the version 1, real first version of the operational plan was released for implementation over the next several years. What is this all about? This really is a model that is a network of networks model. So the idea is to provide a national network that interconnects other local, regional, and even national health information exchanges. This is done through the establishment of what are called Qualified Health Information Networks, or QHINs. Though the documentation and plans don't say this explicitly, we understand from ONC that the expectation is that there'll be a limited number of QHINs. If you figure there are probably more than 100 operating HIEs in the US, we understand that ONC expects something like 10 to 15 QHINs. So in that arena. And the network that they envision is the interconnection of these QHINs, no more, no less. Other HIEs or organizations, as you see in the diagram on the right, are participants within a QHIN's interconnection. So the TEFCA network is the way that different participants connected to different QHINs will interoperate with each other. But it's only the QHIN to QHIN interoperability that is controlled by the TEFCA network. The initial architecture centers around a set of standards and profiles promulgated by an organization called Integrating the Healthcare Enterprise, or IHE. These are primarily standards and profiles around clinical documents and have been used for many years to exchange things like clinical summaries between care or organizations. They're in fact widely deployed in existing national networks like eHealth Exchange, Care Equality, and Commonwealth. There is a plan to supplement the QHIN implementation with FHIR, but that's supposed to come later. And in fact, there was some, let's just say, tension between folks who were more interested in implementing IHE-based standards, which were well promulgated now, but likely will be giving way to FHIR-based standards in the future, and a group that thought that that TEFCA should just move immediately to FHIR. So the compromise that seems to be reached is that the IHE-based standards are the initial implementation, with an emerging plan to move to FHIR a little bit in the future. TEFCA defines a set of exchange purchases. So these are the reasons for why we want to exchange information in the first place. And you can see those reasons on the right side of this slide. It's comforting to us to know that public health was envisioned as even one of the set of exchange purposes from the get-go. Though initially, only the first and last ones in this chart on the right, patient treatment and individual access services, or essentially consumer access to health information, are the only two exchange purposes that will be required initially by certified QHINs. Of course, folks are free to implement other exchange purposes if they want. The architecture allows for both a query response method of interoperability, as well as essentially a message push, which is a good thing for public health. That wasn't included as strongly in some of the initial versions of this that were floated. And a number of us in public health pushed back fairly strongly and said that the message delivery really needed to be included. The Sequoia project is working now on standard operating procedures and implementation guides. Some of those have been released and are available on the TEFCA website. Others are going to follow. And though the common agreement only applies technically to the QHINs and their activities themselves, because the data originates below with the participants and will end up with other participants, it's clear that some clauses, in fact, many of the clauses in the common agreement, are going to have to flow down to the existing agreements that might already be in place between HIEs and their customers. This is a fairly long timeline. I'm not going to go through it all. That shows how the Sequoia project and ONC see this project unfolding over the next a year or so. So you can see we're in the first quarter of 2022, and this stuff is just becoming available. Over the next 3 or 4 quarters, the project expects to complete its governance processes and begin to sign up and qualify QHINs to participate for what will eventually be an implementation starting in 2023. I had mentioned fire, which is very important. They see fire unfolding, and there's a document that describes this essentially in 3 stages. First, because the IHE standards that will be implemented initially don't really restrict what kind of data can be transported, stage 1 will essentially be allowing the transport of fire-based messages inside of the existing IHE transport and standards. The second stage will allow participants in networks that are interconnected using TEFCA to conduct fire exchanges through the fire API, but those API endpoints need to be down in the participating organizations, and the QHINs are just responsible to transport that data. Final stage 3, you see not until perhaps 2024, is a full implementation of FHIR within the TEFCA network. So what does this mean for public health? I think first, most public health transactions don't rely on the IHE profiles and standards that are going to be initially implemented, especially IIS transactions, which are plentiful, but use other standards. But there are some exceptions. FHIR is coming, both to TEFCA, as I showed in the previous slide, and to public health, but those timetables may or may not line up exactly right. But since it will take time for FHIR to become dominant within public health and within TEFCA, it seems to me that rather than jump hoops to try to use the current IHE standards any more than is being used now, public health really ought to wait and plan towards that future FHIR implementation of both TEFCA and public health transactions. There is an IHE profile for carrying messages. Some public health organizations may use it in fact for things like electronic case reporting. But once again, it's a potential point of leverage, but it may be a distraction away from planning towards a FHIR. Remember that TEFCA technically only applies to the QHINs themselves. So it may be possible for participants to use other standards that the QHINs will then translate into the necessary and required standards on both ends of a transaction, as a transaction is going in and as a transaction is coming out. And as this comes to be, remember, public health agencies can participate fully in TEFCA activities, but can't be, by the rules, compelled to respond to a TEFCA-initiated query the way perhaps some organizations might be. A couple of things to keep an eye on. The TEFCA project really hasn't done much with patient identity and matching. It's pretty silent on it, but public health has done a lot in this arena and may in fact have a lot to offer. There's a directory service that has yet to be designed and developed, but is very high on the priority list for TEFCA. And this is an area where public health may actually gain from allowing TEFCA to complete this piece of the puzzle. And though none of this is required, federal agencies may jump into this in a big way, and that in a de facto or default way might bring the rest of healthcare along the line, whether that's CMS as probably the biggest insurer that the United States has, or federal partners like VA, DOD, IHS, which a lot of public health agencies are now starting to work with. The degree to which they embrace TEFCA, I think, might push public health to have to embrace it as well. I hope that you'll get a chance to download a copy of these slides. You'll then get all the links. And again, I want to thank you very much for spending a few minutes with me. No, that isn't me. That's my adorable grandson. And I expect that by the time you view this pre-recorded presentation, my second grandchild will be born. Thanks very much.